Struggling with weak or fading erections after 50? This simple ring could change your nights without a single pill. As men age, many notice something frustrating. Erections that aren't as strong, that fade too soon, or sometimes don't happen at all. Pills are an option, but not everyone wants to rely on them, especially when you're already managing medications for blood pressure, cholesterol, or diabetes. That's where a small, affordable, and surprisingly simple tool comes in: the penile tension ring, also called a constriction band. In today's video, we're going to explore whether this device could be the safe, drug-free answer to better performance, stronger intimacy, and renewed confidence, even after 50. When a man gets an erection, blood flows into the chambers of the penis and the veins close just enough to trap that blood. This pressure makes the erection firm. With age, two things often interfere. The arteries bring in less blood because of conditions like high blood pressure, diabetes, or cholesterol. At the same time, the veins weaken and let blood leak out too quickly. This is called a venous leak, and it explains why many men can still get an erection but cannot keep it long enough for intimacy. A penis ring, also called a constriction band, offers a simple solution. Worn at the base of the penis, it gently limits blood from flowing out. The blood that enters stays longer, which often means stronger firmness, longer duration, and greater confidence. For men over 60, this matters. Some cannot use ED pills safely because of heart conditions or other medications. A reusable ring, usually priced around $30 to $60, is affordable and easy to use. More importantly, it helps reduce the anxiety of losing an erection, allowing couples to focus on connection instead of performance. Safety is critical. Always use products made from medical-grade silicone or elastomer, never household objects. Limit wear to 30 minutes and never sleep with a ring on. Remove it right away if you feel pain, numbness, or notice unusual color changes. Use water-based lubricant for comfort and to avoid damaging the device. Start with the loosest fit and adjust gradually until you find the minimum pressure that works. If you are on blood thinners, have a history of priapism, or reduced genital sensation, speak with a doctor before trying one. Some men also use a vacuum erection device. In that case, create the erection with the pump first, then place the ring at the base to maintain it, and always remove it within 30 minutes. Communicate with your partner and pause if needed. A tight ring may reduce semen release, which is not harmful, but it is a drawback if you are trying to conceive. Used responsibly, a penis ring can be a safe and effective tool for restoring confidence and intimacy. The most common type is the basic O-ring. It is simple, affordable, and usually made of silicone. You place it at the base of the penis and it holds blood in place. Many men with mild erectile difficulties find it effective, although some say it can be tricky to apply or remove. A softer and more adjustable option is the performance ring. This design often uses medical-grade elastomer and a hook and loop closure, making it easier to fit. Some versions include a second loop that goes around the scrotum for additional stability. These are comfortable for longer use, but they cost more than a basic ring. Another option is the giddy, sometimes called the Eddy device. It has a horseshoe shape that avoids pressure on the urethra, which reduces pinching and makes it more comfortable. It comes in multiple sizes, and companies often allow free resizing if you choose the wrong fit. The price is higher, but many men appreciate the comfort and the added ridges that can increase stimulation for both partners. The Ziala ring takes a different approach. It uses an adhesive pad on the back and a band that pulls slightly, which can even give the impression of greater length. Clinical studies have shown benefits for men with venous leak. Most reviews are positive, although some users report skin irritation from the adhesive. Replacement pads add to the ongoing cost. Finally, vibrating rings are designed more for pleasure than for medical use. These silicone devices include a small motor that provides vibration during intimacy. Some are even controlled by a smartphone app. They can improve arousal and prolong stamina, but they are considered toys rather than medical devices. Each type has its advantages. Basic rings are inexpensive, performance rings are easy to use, the giddy focuses on comfort, The Ziala adds support for venous leak, and vibrating rings enhance pleasure. Choosing the right one depends on your budget, your level of erectile difficulty, and whether you want a medical tool or a playful addition to intimacy. The main advantage of penis rings is that they are non-invasive and drug-free. Many men cannot take oral medications safely, but a ring can still provide stronger and longer erections without adding new prescriptions. They are also affordable compared to ongoing medical treatments. Most designs are reusable, so one purchase can last for months. Another benefit is convenience. A ring can be applied within seconds, allowing men to respond to intimacy naturally. For some, it even adds sensation and helps reduce anxiety about losing firmness. There are also clear drawbacks. Rings do not work for everyone, especially men with severe arterial problems, where blood cannot flow in strongly enough. Some men find them uncomfortable or difficult to fit correctly. If worn too tightly, they may cause pain, numbness, or interfere with ejaculation. This is not dangerous, but it can be frustrating, especially for couples trying to conceive. Rings can also interrupt spontaneity because they must be applied before or during intimacy. Finally, there is a small but serious risk of tissue injury if the device is left on for too long or used improperly. In short, penis rings are a safe and practical aid for many men, but they require attention to comfort, sizing, and time limits. For the right person, they provide confidence and stronger performance. For others, they may be an occasional tool rather than a full solution. Many men discover that the first time using a ring feels awkward. It can take a few attempts to find the right size, apply it smoothly, and stay comfortable. Patience is important. A common tip is to practice alone before using it with a partner. This reduces stress and builds confidence. Real-world experiences highlight both the benefits and the challenges. One man in his late 60s described how a basic silicone ring helped him stay firm long enough to enjoy intimacy again after years of frustration. He admitted the first try was clumsy, but by the third time it felt natural and gave him the reassurance he needed. Another man tried a vibrating ring, not because of erectile difficulties, but simply to add more pleasure. He and his partner enjoyed the extra stimulation, though he noted the device was slightly tight. Doctors often remind patients that rings are a tool, not a cure. They can help with venous leak or mild erectile difficulties, but they do not replace healthy lifestyle habits. Quitting smoking, managing diabetes, controlling blood pressure, and staying active are still the foundation of good sexual health. Practical advice is simple. Choose a trusted product. Use water-based lubricant. Set a timer so you never exceed 30 minutes, and remove it immediately if you feel pain or numbness. Talk openly with your partner so the device feels like part of intimacy rather than a distraction. And if you have ongoing difficulties, speak with a urologist. A ring may be one piece of the solution alongside other treatments or lifestyle changes. Selecting a penis ring is not about finding the most expensive or the most complicated product. It is about matching the design to your needs and your comfort level. For men with mild erectile difficulties who simply want more firmness, a basic silicone O-ring is often enough. It is inexpensive, easy to find, and effective for short use. If you want something softer on the skin and easier to apply, a performance ring with an adjustable closure is a smart choice. This design avoids the pinching that some men feel with a fixed ring. For men who are sensitive to pressure on the urethra, the Giddy or Eddy device is worth considering. Its open horseshoe shape relieves that pressure and provides a more comfortable fit, though it comes at a higher price. Those dealing with venous leak may benefit from the Ziala system. Its adhesive support helps keep the band in place and can improve both firmness and perceived length. However, it does require replacement pads and may cause irritation for men with sensitive skin. For couples who are more interested in playfulness than medical support, a vibrating ring can be a fun and affordable option. When making your choice, think about your goals. Do you want maximum firmness for ED support, or do you want to enhance intimacy with added sensation? Consider your budget, your comfort, and your willingness to experiment. Many men try more than one type before finding the best fit. The right ring should feel secure but not painful, effective but not distracting. Above all, it should allow you to focus on connection rather than equipment. Erectile changes after 60 are normal, but they do not have to end intimacy. A penis ring is a simple, safe, and affordable tool that can help many men stay firm and confident. The key is using a proper medical-grade product, limiting wear to 30 minutes, and choosing the design that feels most comfortable. Sexual health is part of overall well-being. Combine smart tools with healthy habits and open communication, and you can continue to enjoy closeness and satisfaction for many years.